I'm Michael Wallace. On today's episode, we're talking about Williamson Health's emergency medical services.
Michael Wallace, Williamson Health EMS Chief, thank you for joining me today.
Thank you. It's a privilege to be here.
Yeah. Okay, so we like to begin these conversations by asking you what initially drew you to healthcare, and then specifically, how did you get to emergency medical services?
That's a great question. Honestly, when I was a child in the early 70s, the television show Emergency came out, which really kicked off paramedics across the country.
Wow.
And it intrigued me from the very beginning, from a very young age. I was about 4 or 5 years old.
Wow, so you just always knew.
Yes.
Yeah, that's great. And speaking of the early 70s, so Williamson Health, in partnership with Williamson County, has been providing the EMS services to Williamson County that entire time for over 50 years, right?
That's right. Back in 1972 is when that relationship started.
Wow. So can you talk to us a little bit about what that legacy means to us as an organization, to us as a county, and maybe to you personally?
It's an incredible partnership. The legacy is a great word for it, and it's very rare. It's a rare model. Especially the length that model has been in existence, and just being a fully integrated part of the healthcare system of the community, it really makes EMS a special component of that system. Yeah.
So 50 years of EMS, and I think you told me you've been doing this for 40 years this year?
This coming spring, yes.
Okay. So in that time, either in the 50 years since we've been providing EMS to the county, and particularly in your 40 years, what changes have you seen in how we administer emergency medical services?
Yes, back 50 years ago, the truth is emergency medical services was very basic, and it was all about more a fast ride to the hospital than it was about delivering patient care, and we've seen that evolve drastically over the last several decades to where now we're providing extremely advanced care with great technology right in your living room or on the side of the road.
Yeah, that's amazing. And so speaking of our partnership with the county, obviously our EMS does not operate in a vacuum. There are so many different partnering agencies that y'all work very closely with, whether it's law enforcement, fire, emergency management, 911 dispatch. Can you talk to me a little bit about how y'all work together in collaboration for the benefit of Williamson County residents?
No, you're right, and you nailed it. It is an incredible partnership. It's a true team effort, collaboration between all of those organizations. Every day there's a lot that's brought to bear with every single call for help that occurs, whether it's working with our law enforcement partners. It all starts at 911, of course, and they coordinate those efforts together and pull together the right team, the right resources for each situation.
And speaking of, just one example of one of those partnerships, is it true, do I have it right, that every 911 call, both EMS and fire is going to show up?
In almost every instance, that's the case.
Okay.
Yes. From an emergency medical standpoint, that's the standard that we've established in our community.
Okay.
And it's a partnership that works fantastic. So it really brings to bear a team of individuals, and we all train together. We work together seamlessly under the same protocols and oversight, and it really works incredibly well.
Yeah. So that's a good thing for community members to know in case somebody calls 911 and both shows up and they're curious as to why a fire truck and an ambulance is showing up. It's just part of our protocol for the benefit of the patients.
That's correct. And whatever other resources are needed, depending on the circumstance, that's when you might see law enforcement show up as well, depending on what the need is.
Yeah. So can you just give us a quick overview of our EMS organization?
Yes, at this point we're over 200 personnel in the department. We continue to grow incredibly fast to keep pace with the community's growth. We're staffing 18 ambulances every day and 3 district chiefs in the field across the community as well. In the last year, we've run a little over 23,000 emergencies. the pace of our team continues to grow just like the community does.
Yeah. So just hearing you give that overview, I'm so excited about our conversation today because there's so many different places I want to go. But let's start with the 200 plus personnel. I know there are different levels of training within that. So can you talk to us about the different certifications and skills that the personnel have?
Yeah, absolutely. And it really is one of the blessings of our team. We have an incredible group of individuals. Yes. They're very talented. Medical licensure wise, we have advanced EMTs and paramedics and critical care paramedics as well. It's a very interesting blend, and we work really hard to allow all of them to maximize their licensure level and capability, scope of practice, that type of thing. And then, of course, we have a wide variety of support personnel as well that helps us pull the team together and provide all the resources that they need to accomplish their mission.
Yeah. So for the layperson that might not know the differences, can you walk us through the difference between a paramedic and an advanced EMT and a critical care paramedic?
All of them are advanced care providers,
okay.
And it really is kind of a tiered development of their training and progression throughout their careers.
Okay.
So you have to be an advanced emergency medical technician to practice on the ambulance.
Okay.
And then as they progress in their career, the next step up is at the paramedic level, which just gives them increased capabilities, scope of practice, that type of thing. And then our critical care paramedics are at the highest level of capability. And almost 50% of our department are critical care paramedics at this time, and it just also increases their capabilities and scope of practice, technology that they're able to deliver.
Yeah. And I know that our organization has been recognized locally, regionally, nationally for some of the great things that this team is doing and has done throughout the years. So kudos to you and the entire team. We're so proud of all of y'all.
It's an incredible group.
Yeah. Okay, so let's talk a little bit about the technology and the equipment that our ambulances have on board, because I know that's another thing that we're very proud of to be able to offer this community.
Yeah, we're very fortunate in that we continue to expand our capabilities and the technology that we have. Just in the last couple of years, we've upgraded all of our heart monitors to the latest technology that's out there. We have intelligent ventilators and non-invasive equipment to help with respiratory problems, which is very unique for a 911 EMS system. Our Lucas devices that you mentioned as well. There's an incredible amount of high-tech equipment that we have available for the staff to deliver care.
Yeah.
One of the great things about our cardiac monitors, and we've had that capability for many years now, is just the ability to maintain seamless communication between the ambulance and the hospital while we're taking care of the patient at the scene. It just helps the hospital to be prepared ahead of time for our arrival, and the physicians are able to see exactly what's going on with the patient while we're taking care of them at the home.
Yeah, so to really put an emphasis on that point, not only when y'all show up are you able to start immediately providing that care in the field, but you're also helping prepare the hospital for whatever needs the patient might need when they get here, whether it's in the emergency department or going straight to the cath lab, whatever they might need, y'all are able to communicate back immediately.
It really does improve care to the patient.
Yeah. So the intelligent ventilator, I think that's new to me. Can you explain a little bit about what that is, what that does?
Yes, we've had ventilator capabilities for several years now, but in the last few years we've placed brand new ventilators on all of the ambulances to respond in the 911 environment with, which the systems that we're carrying now are very innovative, very intelligent systems that allow us to not only provide invasive ventilation, but non-invasive ventilation as well. It just customize the level of care that the patient needs depending on their condition.
Okay. And the Lucas device, I do know what that is, and I think that's so cool. Can you talk a little bit about that device that is equipped on all the ambulances?
Yeah, every ambulance has a Lucas 3 CPR device, which just automates the CPR delivery process. The machine doesn't get tired. So it's just a great tool for us to be able to immediately apply and maintain high quality CPR as long as the patient needs it.
Yeah.
The Lucas devices not only allow us the opportunity for our team to stay focused on the care that the patient needs versus performing manual CPR, but it also creates the situation where they're able to maintain high quality CPR even if they're having to move the patient from one area to the ambulance or while they're driving down the road.
Yeah. And if listeners are more curious about what that system looks like or what it does, I will say we did a video maybe last year, year before, demonstrating what that looks like. And it's on our YouTube page. So if people are interested, they can go learn more there. So I know another thing that we are extremely proud of, our EMS organization was really a pioneer in the industry when it comes to providing blood products in the field. So can you talk to us about that? I know we were first in the state to be able to do this, only fourth in the country. We've been doing this for several years now. So can you talk to us about that?
Yeah, it's incredibly innovative. And you're right, we were first in the state of Tennessee to be able to deliver it on ground ambulances in the field, and one of the first in the country. Yeah. And that has become it's spreading quickly across the United States now. A lot of organizations are finally able to deliver that level of care in the field, and it truly is a life-saving circumstance.
Mm-hmm. So just to drill down a little bit deeper on that, what are a few specific examples in which a patient might need blood administered to them in the field?
Certainly trauma is a reason that we would give blood products, but more often than not, we see it more frequently with medical problems, just like GI bleeds, or certainly OB emergencies, a very common one as well, where we would need to give blood products in a emergency situation.
Yeah. Another thing I wanted to talk about, because I think it's so cool, is the dynamic deployment system we have, the technology for how we move ambulances around the county on any given day.
Yeah, that's true. We have an amazing system built into the 911 dispatch center that allows us to maximize the deployment continuously throughout the day. So as ambulances start making calls across the community and it creates gaps in coverage because an ambulance is on a call, then the system automatically helps us identify where those gaps are and start moving resources around throughout the day to help ensure the best response times possible everywhere.
Yeah, so they're moving throughout the day. Another thing I thought was so interesting when I learned that the staff moves around from station to station. So obviously most of the shifts are on a 24-hour shift, correct? So they're sleeping and they're eating at the stations and that type of thing, and they stay somewhere for a few months and then they move. Is that accurate the way I'm saying that?
Yeah, that's fair. Yeah. About every 4 months they rotate to a different location, and it just helps them to learn the community as a whole and at the same time be grounded in a specific area. Yeah.
And how many calls did you say we're averaging a year?
In the last 12 months, we responded to a little over 23,000 calls, and that number increases every year.
Yeah. So any given day, how do we break that down? How many calls a day is that on average? I know it changes.
On average, it's probably about 65 calls a day.
Wow.
Yeah.
Okay. So we often hear that people are sometimes hesitant to call 911. They're just kind of on the fence. They're not sure if they should call or just drive themselves to the emergency room. So let's talk about, when should someone call 911?
It's a great question. Certainly, if you have any doubt in your mind that you're having a medical emergency, please call. We want to be there for you. Obviously, the typical things that you hear about, if you're having chest pains or shortness of breath, or you think you might be having a stroke, or maybe you've had an accident, some type of traumatic incident, please call. But if you're just not sure and you're not feeling right and you feel like there's a medical emergency occurring, call 911. We'll be there for you and we'll help you figure it out.
Yeah. We also hear that sometimes people think they can get themselves here faster than having to call and have you show up. But really, let's talk through why that's often not the best decision to make.
Well, there's actually a couple of reasons. Number one, if you are having a serious medical emergency and you try to drive yourself to the hospital, things can get worse on the way, and then you have another problem or an accident that occurs. And if you call us, we're going to get there really quick, and we're going to be able to start care immediately and then stabilize the situation and take you to the hospital safely.
Right. And like we talked about earlier, yes, not only starting that care in the field, but then also communicating back with the hospital. If it is a heart episode, getting the cath lab ready and that type of thing.
That's exactly
tremendous
right.
benefit. Good. So call 911.
Please call 911.
Yeah. The very simple yet meaningful mission of Williamson Health is to care for this community. And one of the many ways we do that is through EMS being out and about at many different events. So can you talk to us about that? People might see you at Pilgrimage or Main Street Festival, the rodeo, Friday night football games at the local high schools. Talk to us about that.
No, you're exactly right. And it's hundreds of events a year that we participate in. And it's really all about being close to the community when there's a higher likelihood of an incident happening and a high concentration of individuals getting together. And so we're right there interfacing with the public as the events are going on. And if they need our help, we're there for them. Or certainly we welcome families just to come up and approach our staff and get to know us and let us give them a tour of the ambulance and get them comfortable with what we're there for.
Yeah, I see that every time we are out at an event with you guys. Like the kids love to come up and introduce themselves, talk to y'all, look at the ambulance. Y'all have these cute little hats that you give out to the kids. So I think that's great to let people know if they do see you, come up and say hi, and you can start talking to them about, what a future career in healthcare might look like.
That's exactly right. We're here to serve, and we're a community resource for them, and we'd much rather build those relationships when they're not having a medical emergency and then they're not afraid of us.
Yeah, that's a great point. I love that. Okay, so I like to end the podcast by asking people, what is the most rewarding part of your job?
Well, it may sound cliche, but obviously the most rewarding part is just seeing the incredible outcomes that we see with patients that are having life-threatening circumstances. It's always wonderful to see those outcomes at the end of the day.
Yeah. And I know there's also an emotional component for you and your team. Y'all are showing up every day in some really difficult, challenging circumstances for people. And so we are just so grateful. We are inspired every day by how you care for our community.
Well, we appreciate it, and it's really a privilege.
Thank you for being here today. I think this was a great conversation. We helped educate people a little bit more on the emergency medical services that we offer the community. If people don't know it by now, we are so blessed here in Williamson County to have the organization that we have. So thank you.
Thank you.